Doctors say little has changed at Sydney's Royal North Shore despite a public inquiry into the hospital. A Port Macquarie woman whose husband died after botched surgery says it's time they listen to those on the ground.
An inquiry was held into Sydney's Royal North Shore Hospital last year following a number of serious complaints. It was supposed to find out what exactly was going wrong at the hospital and fix it. But the New South Wales branch of the Australian Medical Association says there's been little improvement.
I think the inquiry identified some of the issues, but it did not really look at the solutions, and we need government to act on solutions from that inquiry.
They say New South Wales Health needs to listen to the doctors working the front line.
We need to see more clinicians involved in management, not only at the local hospital level, but in the area health services.
Port Macquarie campaigner Therese Mackay agrees, but says a culture of apathy and buck passing must be overcome first.
They need support, basically. The ones who are prepared to blow the whistle and stand up for the patients, so that they actually need, if they're given support and they're given immunity against being bullied at work and stuff like that, we might see some changes.
Mrs Mackay has been fighting for answers ever since her husband Don went to the Royal North Shore Hospital for a lung drain and biopsy in April last year. It should have been a relatively simple procedure, but 5 weeks later he was dead. She says if a broad inquiry can't provide solutions to fix the hospital, then they should look more closely at cases like her husband's.
I'd like a full inquiry, and I'd like to see those doctors and the staff who neglected Don so that he died. I'd like to see them have to come before a court under oath and answer questions. And I think in that way is the only way we're going to get any change.
Christy Pritchard in Port Macquarie, Prime News.
A welcome boost for family and children's programs at Lismore. That story is still to come. And calls to end the